Welcome to the deep dive. Today we're tackling a really critical topic: platelet transfusion for active bleeding.
Yeah, it's something you definitely encounter.
Think of this as your rapid revision guide on how we help the body stop severe bleeding when there's a clotting problem.
Exactly. Our aim is to pull out the absolute essentials for you.
Mm.
We'll cover the definition, causes, risks, how it works.
What else it might be, who it affects, the signs, tests, treatment, prognosis, and potential issues too.
Right. All the key points.
Okay, let's start simple. In plain terms, what is a platelet transfusion for active bleeding?
Well, it's essentially giving concentrated platelets, those tiny blood cells, vital for clotting to someone who's bleeding significantly.
And why are they bleeding like that?
Usually because they either don't have enough platelets, which is called thrombocytopenia, or the platelets they do have aren't, functioning correctly. Think of it like calling in reinforcements for the body's repair crew.
Got it. Reinforcements. So, what are the common reasons someone might need these platelet reinforcements? What causes the problem in the first place?
Okay, so the big ones are definitely low platelet counts, thrombocytopenia. A useful way to remember some causes is TCP, thrombocytopenia itself, but also think chemo and production problems.
Ah, TCP, like bone marrow failure for production.
Exactly. Bone marrow failure, aplastic anemia, things like that. Chemotherapy is a major one, as it can suppress marrow function. Certain medications can also cause it or interfere with platelet function.
Right, so it's not always about the numbers, sometimes it's how well they work.
Precisely. You can have platelet function disorders. And severe liver disease is another key factor, as the liver makes important clotting factors. Plus, major events like trauma or extensive surgery can just use up platelets faster than they can be made.
Okay, that makes sense. And who's particularly at risk? Are there specific groups more likely to need a transfusion?
Yes, there are. You can maybe think BMOC for this one, B for bone marrow disorders, M for medications, especially things like antiplatelet drugs.
BMOC.
OEVO for organ failure, specifically liver disease, as we mentioned. C for chemotherapy patients. And maybe add an S on the N, major surgery or invasive procedures. Those groups are definitely at higher risk.
BMOCS, helpful. So the transfusion is given. How does it actually work? What's the mechanism to stop the bleeding?
It's all about restoring hemostasis, the body's natural process for stopping bleeding. The transfused platelets boost the overall count, sure, but crucially, they provide functional platelets.
So they get to work straight away.
Pretty much. They travel to the site of injury, stick to the damaged vessel wall that's adhesion, then they clump together, forming a temporary plug. That's aggregation.
Adhesion, aggregation.
Right. And then they release various factors that help stabilize the clot, making it stronger. Little biological repair kits, essentially.
Cool. Now, how do clinicians decide, yes, this person needs platelets? It's not always straightforward, is it? What else could be causing the bleeding?
No, it requires careful assessment. You look at the clinical signs: active, significant bleeding combined with lab results showing low platelet counts, or tests indicating poor platelet function.
But you have to rule other things out.
Absolutely. You always consider differential diagnoses. Could be a deficiency in other clotting factors, perhaps, like hemophilia, or maybe an issue with the blood vessels themselves. You need the full picture.
And thinking about the UK specifically, how common are these transfusions?
It's difficult to give exact figures nationally, but platelet transfusions for active bleeding are, well, a relatively common and essential intervention in UK hospitals.
So standard practice in many situations.
Yes, particularly in hematology, oncology, intensive care, and surgery. How often depends very much on the specific patient group and their underlying condition.
What signs should make you suspect someone might need platelets urgently? What are the clinical features we look for?
Obvious heavy or uncontrolled bleeding is the main one.
Yeah.
But also look for subtler signs like petechiae, those tiny pinpoint red or purple spots on the skin.
Petechiae, right.
Easy or spontaneous bruising, bleeding from the gums, maybe nosebleeds, cuts that just seem to bleed for ages, unusually heavy periods in women, or bleeding that occurs after a procedure or surgery that seems excessive.
Is there a mnemonic for that too?
You could try beach P, B for bleeding uncontrolled, E for easy bruising, A for appearance of petechiae, C for cuts bleeding longer, H for heavy periods, and P for post-procedure bleeding.
Each P. Nice. Okay, so you see some of these signs. What investigations do you order?
First off, a full blood count, the FBC. That gives you the platelet count itself. Very important baseline.
Standard procedure.
Yeah. Then a peripheral blood smear is often helpful. Looking at the blood under a microscope can tell you about platelet size and appearance, maybe hint at the cause.
And beyond that.
Depending on the situation, you might need specialized coagulation studies, platelet function tests, and crucially, you'll investigate the underlying cause of the low platelets or dysfunction. You need to know why it's happening.
Right. Treat the cause, not just the symptom. So let's say the decision is made, transfusion needed. What's the immediate management plan?
Speed is often key. So first, recognize the severity of the bleeding. Get those urgent blood tests done, FBC, maybe coagulation screen. Then, based on clinical judgment and the lab results, make the call to transfuse.
Following guidelines, I assume.
Absolutely. You follow established national guidelines, like those from the UK Blood Services, ensure ABO compatibility, administer the correct dose, and monitor the patient closely during and after the transfusion.
What about the prognosis? What can people expect after a platelet transfusion?
It's quite variable, honestly. It really depends heavily on the underlying reason for the bleeding and the platelet problem, as well as the patient's overall health.
So controlling the bleeding is just one part.
Exactly.
Huh.
But getting that transfusion properly and appropriately significantly improves the chances of controlling the acute bleed, preventing complications like hemorrhagic shock, and hopefully contributing to a better overall outcome.
Okay. And are there downsides? Any potential complications we need to be aware of with platelet transfusions?
Yes, like any blood product transfusion, there are risks, although generally it's safe. You can get transfusion reactions, allergic ones, or febrile non-hemolytic reactions, which cause a fever.
Common ones.
Relatively common, yeah, but usually manageable. There's extremely small residual risk of transmitting infection despite rigorous screening of donations.
Very rare now, though.
Very rare, yes.
Yeah.
Then there are rarer but more serious things like trail eye, transfusion-related acute lung injury.
Right.
And if you give fluids too quickly or too much volume, especially with multiple blood products, you can get circulatory overload or hypervolemia.
So careful monitoring is essential.
Absolutely vital during and after the transfusion.
So just to wrap up, platelet transfusion is a cornerstone therapy for managing potentially life-threatening bleeding caused by platelet issues.
Definitely. A really vital tool in our arsenal for these critical situations. It directly addresses the lack of functional platelets needed for clotting.
It's amazing how these tiny cells play such a huge role. Makes you appreciate the complexity.
It really does. And research is always ongoing to make transfusions even safer and more effective.
A space to watch. For everyone listening who wants to cement this knowledge or explore other MSRA topics, do check out pastamsra.com and also freemsra.com.
Great resources for revision.
Thanks for joining us for this deep dive today.